Alright, so we're looking at another aspect for labor. That's a woman that is kind of like actively in labor, trying to give birth and all of that. So we're looking at vaginal examination for her, okay, for a woman that is in labor and all of that. So for vaginal examination for a woman in labor, we're saying it's actually a critical clinical procedure, okay. Of course, if you are doing a vaginal examination, you are trying to assess the progress of childbirth, and this will help you make decisions about the care, okay, what to do to the woman, okay, how everything will go like. So purpose of vaginal examination is to assess cervical dilations. So you want to see how wide the cervix has actually dilated. So they use one hand, they use two fingers, okay, it's fingers, right? They use one finger, two finger, three finger, and the rest. You want to also evaluate cervical effacement. This is how the cervix has become thinned out. You want to determine how far the baby has come. You want to check which part of the baby is actually coming, okay, and the position. You want to monitor the progress of labor and dictate if any abnormalities will come up. Then you want to identify membrane status. Okay, so vaginal examination. This is a manual, okay, examination. So what the clinicians feel, they feel for cervical dilation, they feel for cervical effacement, they feel for the head of the baby, they feel for sutures and fontanelles, they feel for membranes, then they feel for if there's any swellings on the head or if any injuries has actually occurred, okay. So it's performed with sterile gloves and lubricants. The woman is positioned. Can you see that her two legs are actually up? That's lithotomy. Okay, so examiner inserts two fingers into the vagina just to look out for the cervix and the fetal parts. So findings are usually documented and used to guide labor management.